Okay, welcome to another episode of Dental Spotlight. We are honored to have the great David Zelig join us. David Zelig is a board-certified oral and maxillofacial surgeon holding a bachelor's degree from the University of Memphis and a DDS from the University of Tennessee College of Dentistry. He further honed his skills as a oral maxillofacial surgeon resident at the Long Island Jewish Medical Center. A fellow of the American Association of Oral and Maxillofacial Surgeons, the American Dental Association, and the New York State Dental Association, David Zelig is dedicated to advancing the field of implant dentistry.
Be great and late.
So welcome. Thank you so much for coming.
Thanks for having me.
We were just finishing up my first zygoma surgery that I've assisted on many. I did my first one. We tag teamed.
I'm so proud of you.
I did one, and thank God it was a great experience. After learning, reading Dan Holtzcall's great book on zygomas, taking the cadaver course with him, we were ready to get a handheld and get the first zygomatic in. But I want to credit David to the opening my eyes to the concept of what we call extramaxillary fixation. Because it really is an amazing tool to open up to patients who have been told this is just not in the cards for you. Teeth is just not what you have to look forward to anymore. To give those people that ability is really just a gift to the world of dentistry. So to open up my eyes, I personally thank you. But to the field in general, just being a great contributor to the field, I think we all love to thank you.
Thank you. Thanks for having me.
Good. We'll get into a lot of the mentorship and what you do for the field as an ongoing basis in a little bit. But first, just to talk to the man himself. Tell us a little bit about your upbringing, where you're from, and what brought you to this space in life.
Started life like everybody right here in Brooklyn, but ended up growing up in Far Rockaway. Great family, great friends, great community, great school. Went to South Shore back when they had a high school. The high school actually closed after 11th grade, so they kicked us out early. They graduated us early. I was young because I had already skipped first grade, so ended up going to Israel to yeshiva there, and I wanted to stay, but I was just 16, then 17, and my parents came to get me.
They actually came to get you?
They actually came to get me.
Because we're talking now circa, this is what year? Yeshiva.
76, 77.
So the 1900s, right?
That's the 1900s.
1900s. So that to a plane ride there was not like the...
Well, I really wanted to stay, and there were discussions, and it was really more like, they wanted me to not just stay and go right into the army, etc., but they wanted me to go to school first and then come back. And it's taken me a really long time.
Right.
Yeah. Get out of school, but it's been a little while. But I'm back and forth.
Great. And as you know, I had the same experience with my wife. We got engaged during my second year of yeshiva in Israel. She was already back at Stern College, studying there. Came to surprise me, that she thought surprising me, for a trip in the mid-winter break week. I planned it with her parents and my parents in advance to propose to her then.
Oh.
But then she literally dragged me back. After that, it's like, okay, we'll come back to Israel one day.
You closed the circle.
One day. But so it comes, there's both of us that are schooling back in the States. Good. So tell me some of your early influences in your childhood.
I'm afraid to tell you.
So be afraid.
Americana was actually a big one.
Fantastic. Wow. Okay.
Americana was, I was a mid-teenager, I guess, young teenager, and it was a time specifically, the memory that I have was it was a time when Jews were getting mugged on Friday nights. They had nothing to give.
Was it just Friday nights?
No. They had nothing to give. They had nothing to give the robbers on Friday night, and the consideration was: should we allow Jews to carry money so they can give the robbers something so they won't get beat up? And as a child, I thought,
just for those in the non-Orthodox Jewish circle, Orthodox Jews don't carry money, phones, anything in their pockets on a Shabbat. So if they're going to get mugged, it's going to be not a good day for the mugger, but also will incense the mugger. What do you mean on anything on you? A rabbinic consideration to allow Jews to carry money to give something to a mugger right?
It sounded preposterous to me because the more logical thing to me was allow them to carry something to defend themselves.
Exactly.
And so in those days it was karate, and then ultimately taekwondo, and then NYU was wrestling, and then powerlifting, and it was always that wanted to be that bear Jew.
Okay.
And he was, I call him a pretty significant influence.
Sure. He was assassinated in what year? We're talking, was it the 90s? Was it even the 90s? Late 80s?
No, sir. I remember the guy's name, but I don't remember the date.
Yeah, he was saying it was in that basic time period. He was assassinated on his speaking engagement in New York.
At a speech in front of all these people, and the murderer was not found guilty of murder.
What was he found guilty of?
A gun crime, carrying an illegal weapon.
Right.
Even though he had a room full of witnesses, but they couldn't take the bullet out, if I remember the story correctly, because he didn't have an autopsy because of Jewish reasons. Anyway, it's pretty preposterous.
Wow.
And somehow history is repeating itself.
Yeah, that's crazy. It's crazy. Okay. And so in terms of just standing up, being a proud Jew, being a person who's willing to stand up for what he believes in, those are the influences. Wow, interesting. Any other people, family members, things like that kind of led you to the career of dentistry, something that inspired you in that direction?
No, actually, I was going to go to law school to join my father at his law practice.
Right.
And
your father was a lawyer, was a judge also?
He ended up becoming a judge later in his life. But he was a real mom and pop shop lawyer. His fame started early because he was the lawyer for those in New York that were fined for being open on Sundays when there were blue laws.
Wow.
So he was in the old Yiddish newspapers as the Yiddish lawyer, Moshe Zelig, that
a lot of people defend you for being
open on Sunday because they were closed on
Saturdays, right?
Anyway, that put him on the map. But somehow I was in YU, not pre-med, with everybody else that was pre-med. So somehow I seemed to follow the herd and ended up volunteering in the emergency room at Queens General Hospital. And the coolest thing to me then was seeing this facial trauma somehow that got me. And I followed the guys, the only people treating it there were the oral surgery residents, and then followed them to the oral surgery clinic, and saw these workups for orthodontic surgery. And I said, that's what I want to do. And they said, well, then you got to go to dental school. And that's why I went to dental school.
Amazing.
It's a long way around, but that was after I did the LSAT.
Okay. Oh, so you were deep. You went deep through college.
Well, and then I ended up doing the DAT and the MCAT. And
it's a lot of...
I found that I had
letters.
I had some kind of talent for those exams, not for the knowledge, just how to take the exam.
Sure.
So I ended up teaching Stanley Kaplan's through dental school.
Oh, wow. That's great.
The LSAT, the MCAT, and the DAT.
That's so interesting.
That was kind of cool.
That is cool. They probably don't have one person that gets each
of those. But those
see that else. Maybe the MCAT
set recorders.
Wow.
Click, click, click. Yeah.
That's great. Fantastic. Okay. So let's say as you started to mature into, you mentioned you went to the University of Tennessee.
Right.
What brought you from New York to Tennessee?
Some people claim it as a woman to blame.
Okay.
So I met my first wife she was a Stern girl, and we ended up moving to Memphis.
Girls always bring
still in college, finished college there. Dental school there, came back to New York for residency, and back to Memphis after that for private practice. We opened a practice there, and stayed there about 20 years.
Oh, wow. Okay. All right, so big practice out in Memphis. What do you see the difference between, let's say, Southern dentistry versus Northeastern dentistry? Do you see any differences in culture, practice?
Present company notwithstanding, we once came, this is a great story, a group of oral surgeons from Memphis, and there must have been, I don't know, at least 10 oral surgeons that came to a perio practice on Park Avenue. I think it was called Park Avenue Perio. Papa? Anyway, I wonder if they're still around. to learn the limited management of the sinus floor, which we now call a sinus lift.
Right.
And we all came, and all these other docs that were there were like, wait a second, you guys are all in Memphis, you're all oral surgeons, and you all like each other? They were shocked that everybody got along. And it was the first I was exposed to anybody not liking their peers. I mean, and most natural friendship for us should be somebody that shares everything that we 100%. Are passionate about, 100%. The ups, the downs, the hard times, and everything else. So that was one difference between New York and the South. Overall, just, I don't know, I just think people were happier.
Yeah, the pressure cooker that is New York City can sometimes get to people. And back to your point about the colleagues, I've never thought of another office in the area as being competition. I've always thought as a colleagues. Right. And people always look at me like, but they're going to take your patients. Like, no, they're not. There's plenty of patients.
There was a guy, when I first moved back to Memphis to open my practice, everybody, I was looking for a spot, and everybody said there's no room for another one. This is in the oral surgery community. There's no room for another one. There was one oral surgeon who was from Louisiana originally, Roy Burgoyne, who's passed away long ago. And he sent me a letter that was essentially a pat on the back, because in the letter he said, there's always room for another good one. And it just is the way I lived from then on, was there's always room for another good one. So just probably how I ended up coming around to mentoring everybody.
Exactly. And I think that plays a big part of it. Some would say I have a unique set of talents, and I'm going to keep that very close to the vest, and you'll send everyone to me, and I'm only going to do this. Or you can take the exact opposite approach and say, this is something that is a great, benefit to our patients. Let's share this as wide and far as possible to get this out as much as possible. And the reality
I don't know about the talents, but I keep trying. I try hard anyway.
But the flip side is you end up, when you try and keep it so close to the vest, everything gets smaller. When you're sharing, everything gets bigger. The pie gets bigger, right? Everyone benefits more. Right. This concept of dentistry, I think it exists in a lot of fields, but in dentistry we see it specifically, right? Someone comes into, a patient comes into your office and you see less than ideal dentistry done. Many offices, knee-jerk reaction is, who did this to you? As opposed to, let's try and figure out what happened here, how we are at this point, and figure out sure, there are people who have bad days. There are some clinicians out there that are just poor clinicians. That does happen. It's rare that someone's actually poor, that went through that much schooling and training. You have to not care at that point. But yeah, much rather just I've myself gotten the phone many times. I remember when I was early on. My mentor was Sheldon Lerner, was my personal mentor, and the quote-unquote competition in Brooklyn then was Jay Rubin. Maybe we had a patient in common, left me, went to him. He got on the phone with me and said, hey, you're young, I know you're just starting here. This patient came, he's got X, Y, and Z complaints. If you'd like, I'll push him back to you if you want him off your table. But everything, we're all good here, right? And that's just the way, but as a young dentist was, very uplifted to feel that, but it could have been exactly the opposite. I remember walking into someone's office and saying who are you to do this? It's so much competition here. Get out of here. You just started it. Go find a place out of town to work. That may be a good idea to take, but no, to uplift each other in our career, because we do. We go through so much that we should be the most natural allies. Absolutely. Professionally, who was your greatest mentor?
Well, I am so fortunate. We say that we stand on the shoulders of giants. I've had a lot of giants. In oral surgery, Steve Sachs was a giant for me.
LIJ?
LIJ. The late Marty Stern. There were so many. I went back to Memphis, opened my practice, and there was an older oral surgeon, he's at least 20 years older than me, that was practicing there, Gil Stein. He became such a great friend, and we'd operate together very regularly. Great guy. So
that's great.
No shortage.
And aside from the professional, instruction, anything that you could take from any of that that has resonated with you through your career?
When I came back to New York after the circle, we'll get into it, I'm sure, in a little while. Came back to New York, I opened a couple of Clear Choice dental implant centers. I was the surgeon that opened a couple of them. And the night before we started, is generally the way they do it is they get one of their granddaddies of the business, a more senior surgeon, talk to you the night before. And the one that came was a guy named Tom Berry. Tom Berry is an oral surgeon who was in Atlanta at a major oral surgery practice. So I'm like the southern. I'm in Memphis doing a lot of orthodontic surgery and others, and he was in Atlanta doing a lot of orthodontic. So we knew of each other, I think. And he called. He says, "Dave," he knew what I was into in life. He said, "Dave, remember those cases you got these 16-year-olds and get them through a year and a half of pre-surgical orthodontics, and you get them through surgery in a few months of that post-op, and then you get them to post-op ortho, and you get them finished, and you realize, wow, I just changed a life. How about if you do that every day?" And that just really resonated, because it really does feel that way. When we do what we did this morning, was I'll call it a life change in a small way, but it's for them.
I think it's so small.
It's a big way. Yeah. For them, it's a big way. And to be able to do that every day is a privilege.
Multiple times a day, right?
Well, but still, it's a privilege each time.
Absolutely. I think touch on that idea of the life-changing nature of these procedures. I just lost my first tooth the other week. I took it out myself. I'll post a video about it soon.
Seriously.
I
didn't take mine out. I just cracked it and then okay.
It was a number 8 that had already, we forcibly erupted it to try and get, we knew it was going, it was traumatized when I was a kid.
What's that there now?
I got a cantilevered 8 to 9 situation.
That's great.
My brother is also a dentist, shout out to Paul Minkley. I flew out to Cleveland for a day. He called me, this is a crazy story. I wake up and I knew it had to go soon. It was loose, but it's been loose for 20 years. Like, I knew it had to go at some point, but it was at its point. Out of nowhere, I have a dream that it fell out. It wasn't more loose anytime recently, but I woke up in a panic. I checked my phone. It's 2 a.m. It happened to have been my birthday. I didn't realize it was my birthday that morning as I woke up in that panic. My brother texted me the night before, "Hey, the Celtics are in town in Cleveland." We both grew up in Cleveland. He's a private practice out in Cleveland. "Celtics are in town. It's your birthday. Let me bring you to a game. Fly out to Cleveland, and we'll go to the game tonight." I think to myself, well, my tooth in my mind is already out. I know you're a great dentist. You can get this done for me. What the hell? Let's do it. Flew out to Cleveland. We sat courtside to the Cavs and Celtics. The Cavs got destroyed, whatever. That was the lesser part.
That's great.
Showed up at his office in the morning. I had to talk him into prepping number 9. He didn't want to. It's like preserved tooth structure. I said, "Screw the tooth structure. I am not walking around the flipper for the next."
I'm really glad you accepted me. You have an arch.
Yeah, exactly. So he cantilevered, CEREC milled, a zirconia cantilever bridge. Good. And now I'm going to go through the grafting and necessary to go through. Yeah, it was great. But yes, these are life-changing procedures for sure. One tooth is already a big deal, especially an anterior tooth, but to know that the patients we're seeing in these conditions have been broken down by the dental system. I mean, propped up by the dental system. I don't blame on dentistry. Their dental health has beaten them down over the years, and by the time they get to us, it's such in their minds, it takes up such a huge amount of real estate.
Yeah, in the words of Paulo Malo, they're dental cripples. No,
right.
That was brand mark.
Yeah, it's and I always tell patients, my goal is that you forget this ever happened. You just live your life. You forget dental issues were a thing. Because most people helping mouths don't think about their teeth. Any part of our body that we're helping and doing, we don't think about it. And that's what a blessing it is. To give that blessing to somebody to not even think about their mouth.
I used to not think about my hair. All right.
Exactly. But to offer that to people is really just a blessing to be part of a profession that we can do this for people on every level. Let's see. We talked about a strong personality as being a big influence. It's just, this is who you are. Something in the world of dentistry that you would say, I do this, I know the world stands on one side, I'm here, but I'm standing here. Something you could think of there was counterculture, maybe no longer because now it's already been accepted as you were right. But something you could think of that stood against the grain of the way you did things, and either for...
professionally, I think way back when it was kind of early days of total joint replacements. You know, I had patients that were suffering and had multiple surgeries, and I won't say I was an early adopter, but I used some of the previous generations of total joint replacements back then. I was considered a bit of a, I don't know what to call it, radical, I don't know, but that was one. And
Total joint, like TMJ?
yeah, that was one. I think I was selective in my patient selection. I was pretty careful. Did pretty well as far as good success in helping patients. And then we can go to this remote anchorage. I mean, the idea of using some of what I term bones that don't go away instead of trying to graft in a Sisyphean kind of way when you know that the chances of success are not that great. But I looked for other alternatives. I didn't just say, this is what I do, so I'm going to keep on doing it. I guess I would push that envelope a bit.
Right, that for sure. Tell me about your first remote anchorage. How you kind of got involved in this world.
This is cool. I was doing zygomas for a while. I mean, I learned it the Brandemark way years ago, and then ultimately this extramaxillary way. But the first pterygoid cases the first pterygoid case I did in my office in Israel, and I got a guide. I used a guide, and the guy, the engineer from the company, who was the head of the company at the time, came to the case and said, so tell me what we're doing. I said, well, the zygos I've done without guides for a long time. I don't have a problem, but the pterygoid, I'm really kind of afraid of doing the pterygoid without a guide. And he asked me why. And I feel like I'm talking to an engineer. And I said, well, it's because there are bleeding things there. And he said to me, in his Israeli accent, he said, that's all lateral, go medial. And it was like a life-changing moment. Like, yeah, all the bleeding things are lateral for the most part. There was something to worry about medially, but yeah, that was a life-changing event to me. But anyway, that was my first pterygoid case. And we have a respect.
And what
we have a respect.
What year back? How far back are we going there?
15 years ago.
Okay.
I don't know.
It's not so long.
No, it's not that long.
No.
No, pterygoids, yeah. I mean, all my what I called pterygoids before that were really tuberosity.
Tuberosity, exactly. but yeah, this is a whole different.
So that was
world.
It's just the first other remote anchorage zygos and later transnasal.
Zygos were earlier?
Zygos were earlier for me, yeah.
What was your first zygo? It's like a facial reconstruction, cancer sort of situation?
Oh, the first was the modem Brandemark. That was
right.
A long time. No, it was just a severely atrophic maxilla.
So that's been in your toolbox in terms of treatment planning?
Yeah, a long time.
Long time, okay. And just it's advanced in the course of time?
Yeah, eventually it became just another implant, so that this is a case that needs a zygo, this is a case that can be done conventionally. And then there were conventional cases that turned out not to be so conventional, that you get into bone quality that is, and go on and do something else, and you have to have something else, because we don't do that, but I have not failed to load a single case immediately.
Wow, that's great. Yeah, exactly.
So
good way, Marvin. You have that in your toolbox.
No, seriously. So I always needed some other way out. I mean, if this doesn't work, what's then? What next? What next? So.
Yeah, I don't have them often. Occasionally, I've had a couple of mandibles that are just styrofoam inside.
Yeah.
And I know the literature will say that something like 25 newtons is enough to load, especially you could do less if you have better, more composite torque between all the implants. Those just make me nervous.
Yeah.
So I'm more ready, and it happens 1 or 2 times a year with all son sewing home in the denture. I always tell them in advance it's a possibility, so that I don't want to feel like I'm married to it, but I don't have as many tools in my box yet as you do. So
listen, it could happen. It could happen tomorrow. Not to say that there aren't complications. There are. This is, like I said, there's a learning curve, and anybody that doesn't.
Would you ever engage the cortical floor of a mandible?
I have.
Have
yesterday.
That's it.
I knew I was getting into this. You look at a mandible, and it's like, I think I could have an echo if I yelled in there. It's like a hollow mandible.
Yeah.
It was an osteoporotic patient, and I was more worried about the maxilla, to be honest, but fortunately I was able to find another cortex in the maxilla nasal floor, that kind of thing. So it's always a matter of finding another cortex.
Exactly.
So in the mandible, you just find another cortex.
Right. And I think
hopefully not the roof of the canal.
Yeah,
another
exactly.
cortex.
I remember learning, when I studied for my boards, learning about the transosseous implant. That's where I learned about it.
Oh, that was
where you had
cool
a nut and bolts.
That was great. Hans Bosker. I learned it from him.
And I keep looking at something. Is that a trick question?
It
what were they doing? What?
It worked.
Of course it would work.
It worked great.
But these were stainless steel. These were not.
No. This was a gold alloy.
Gold alloy. Okay.
No, you're talking about a small staple. So a small staple, Irving Small, I think was his name.
Okay.
Anyway, that was a different version of this. Hans Bosker worked around the same time that Brannemark did to describe osseointegration. When he described it with titanium, Bosker showed that you can get a gold alloy to osseointegrate as well. You can have an absence of soft tissue between the bone and the implant. So it was a gold alloy with a separate plate that then got fixated with transosseous posts that went through, creating a rigid box frame, which is the same thing we're doing now for the severely atrophic mandible. That was, wow, boy, I've been in this business a while. Because until my first Bosker case, my atrophic mandibles went to the operating room and I took iliac crest bone graft and I rebuilt them. Same with the maxilla. Maxillas, I did the same thing. I did these horseshoe grafts, iliac crest bone, and then 6 months later, miserable because they've been wearing this half a denture for 6 months. If there's enough bone, I put some implants in, and if those implants work, then they can get a removable overdenture.
Right.
Wow, that was the last bone graft. Last online bone graft I did was the first time I did a Bosker.
Wow.
Yeah, there were great things out there.
Okay. Yeah.
We try anything.
And also just a lot of theories, and just I always love looking back and seeing how were people thinking. What were you thinking to do the next thing? And we'll sometimes look back at something that didn't ultimately pan out and become mainstream. It doesn't mean they were wrong. It means that, okay, it didn't work out for X, Y, or Z reason, but they were thinking, what?
Wow.
My patient's a problem. I need to get them from here to there.
I look back at some of the things that I was thinking. What was I thinking? But that's another story.
But in terms of just always being on the lookout for what can I do better, what can I do new, think out of the box. How do I solve this problem? I think a lot of us get stuck in what do we do every day, especially in dentistry. We're just repeating the same things.
No, I love the challenge.
I feel like in surgery, less. In general dentistry, I feel like it's more. Or it's just like, just drill and fill, do the same thing all day, every day. You got to always take a step back, breathe. Look at the person walking in. What can I do for them? Because it's, not everyone needs the same answer. Every situation is different. We could always do better.
Well, I always said the answer is all in four. What was the question?
Exactly. Good. Let's see. Tell me about some of that. We talk about patients and just reaching. These are human beings we're dealing with. Anyone you can remember recently or going back, a patient of any variety, any procedure you did for them that you feel like, wow, I really made a difference in this person's life, and there was a connection that they really felt, wow, Dr. Zelig, you really made a difference in my life.
I got called to the emergency room for a patient that was attacked by a person with a machete.
Wow.
Wow, I do remember that. So I get called and I take patient multiple, not just facial lacerations. One was right by the eyelids and also caused a frontal bone fracture. That's how deep it was. Anyway, so I took care of the patient and fine, everything, initial healing, all good, everything's fine. It was a couple of years later, I ran into her somewhere else completely. She didn't recognize me. I know what a difference it made for her. She looked fantastic. I took pictures of her and I said, do you want to see what you look like? And then she says, oh my God, it's you. Once I said, do you want to see what you look like? And wow, that was a good one.
This was in cell phone days, or you had pictures on your phone?
Oh yeah, this is not that long ago.
Oh wow.
It's not that long ago.
Wow. Where are you seeing facial trauma still?
Not now. I haven't since I became an archer, I guess, if you want to call it that, in the last few years. But this was in Middletown, New York.
Wow.
Yeah.
So I'm saying you were on staff at the hospital.
Yeah. I'm still on staff there.
But did they call you and your kid called there?
I started it, so they wanted to become a trauma center, and they had no facial trauma coverage, and they needed it. So they actually hired me to cover facial trauma, and I started that and brought in others.
Wow.
My buddy Mindy Markowitz has taken over for that.
Nice. How does one get attacked by a machete in the streets of?
So it was her friend, a girl friend, whose boyfriend was on meth. Like that. One of those.
That'll do it.
Yeah.
Okay. All right. Wow. Interesting. Okay. Just trying to think of in terms of our patient connections, how we, relate to our patients. I know one of the big things in the dental world is giving our phone numbers for a call for patients. Tell me about the most inappropriate call that you've gotten from a patient. Because I feel like with you, this is going to be a story.
Can I play?
Yeah.
Oh my God.
Let's do it.
I saved this. This is great.
I find that 99% of our patients call appropriate, probably don't call enough.
Well, okay. So
we'll always say, Doc, I know I've been bleeding all weekend, but I didn't think I don't want to bother you. Like, that's what I'm here for. That's why I give you the number.
No, this was a little different. This actually turned out to be a wrong number, but this was from Memphis. So listen.
Sure, we'll dub the audio in later if we need to.
Oh, wait. Hold on.
I'm calling when she goes, Daddy.
Okay, you ready?
Turn it away.
Remember me? This is Miss McClure. I'm calling when she goes, I didn't come yesterday because I had diarrhea. And I didn't
Heard diarrhea?
to try it. So I'm just giving you a call back when you get a chance.
Anyway, she called the reverend.
Her reverend.
Her reverend that she didn't come to church because she had diarrhea. I don't know. That was an accident. I can't think of one like that. I'm sure they're out there. Just fortunately, my memory is leaving me.
I had the sweetest old woman once call me. I treated her and her husband. I treated her for years. Sweet little old lady. She called me over it was a 3-day Jewish holiday, so I didn't have my phone. Someone covers my call when I'm unavailable. She didn't want to speak to anyone. She only wanted to speak to me. And I had not heard cursing like that out of it. I don't think anyone. This little old lady. I'm holding the phone back with my wife, and we're just cracking up. I can't believe so like this. She was unhappy. She couldn't reach me for 3 days. But she ended up being no big deal in the end. But yeah, people sometimes can be inappropriate.
We are generally very available.
Let's see, talk about back to procedures. If you have to say, over the course of your career, your favorite procedure that you like to do. Say, we can put arches on the table, but think within even the world of arches, what part of that world do you like to do the most?
I really love my job. It's amazing.
So your kids.
I really love my job.
You can't choose one.
More.
No, I'm saying, like your kids, you can't choose one. Which one do you love more?
I mean, I can go back to like being the address for third molars in Memphis and taking care of people. They're now calling me about their kids need their wisdom teeth out. Am I still doing it? And that's,
are you still doing it?
I mean, if it happens, I'll do it. I just generally
right.
I loved it. I loved anesthesia. God, I loved anesthesia. I still love anesthesia. I just, the idea of, I ran into somebody not too long ago who reminded me that I took care of their daughter and the line just stuck with them. That, man, it was one of these, the kid was really nervous and really anxious and everything else. And, I said something like, I got just the thing for it. Now, it's just they remember some of the things I said back then. But that was now, and then orthognathics just got me. I loved it. A down fracture to me was climactic. I loved it. I loved it. And then I got all of it. And then the arches have kind of taken over. It's so weird.
I think just the arches is there's such a huge demand right now.
This is
the way we are in.
But I don't know. My niche is I dug myself a really deep hole because I'm only getting called for really challenging
hardest of the hard cases, right?
So I just love the challenge.
That's great. dentistry is known as having the, I don't know if it's true or not, but the highest suicide rates of any field. I don't know if it's true. Do you know of any? I'm trying to think of any dentists who I know have committed suicide.
I do know of at least one.
So what have we lost?
Two.
Yeah, well, recently. But
three.
Okay.
Oh, wait a second. No, so I do, but I don't know. I can see why.
Right, we come from it's a stressful job inherently, right? We're taking people into an inherently stressful situation.
Only if you care.
It's true. That's true. And it's a delicate balance between caring enough, because you can't be a sociopath.
You do have to care.
But having a thick enough skin to be able to do this job, because you come to someone to anesthetize them, as simple as that, for any dentist out there, that is inherently traumatic. But it's a necessary evil to get to what we need to do to help our patients. But the career is inherently stressful. What would you find was your greatest stress in the world of dentistry?
Running an office.
I probably don't want to answer that.
I am in heaven right now. I am in heaven right now, running an office.
Yeah.
Discussing fees with a patient.
Sure. Whenever I sit down with someone and fees are on the table, I have my office manager finalize the fees with everybody, but I like to give them a ballpark to know what we're talking about. And we're in Brooklyn, everyone wants a deal. And I just tell them, we deal, I lose every time. And I need to feed my family, I need to keep this office open. So I'm giving you the fairest fee possible, and that's just it. It is what it is. We can work on payment plans and make it work for you, but I can't negotiate fees. I make it as fair as, before you ever walk in this room, I make it fair. But yeah, I hate that.
Are we unique though? Because I can't imagine if a plumber came to my house and told me here's how much it's going to cost, and I'm going to start to maybe it's me, there's something wrong with me, but I don't know.
I don't know. Maybe
I need to do that at the grocery.
Right. Exactly. Right. It would never happen. Now, you don't walk to the grocery store and be like, I know it's
$3.50.
But yeah,
I can't imagine.
But it happens. I think universally in dentistry, there's a feeling of a negotiation.
Maybe we need to do that more.
Exactly. So yeah, I just stop it before it starts, because I'll lose every time. And you offer it to one, and you give them a little break here, and then they tell all their friends, and you did it for them, and you just make the situation worse. So yeah, I would agree. It's highly stressful. As you know, I just opened an office in Israel with one partner. We have 8 doctors at this practice. Your brother, one of them. We'll get him on this podcast soon. Nobody wanted any part of ownership. Right. Like, come on, we'll all invest together. We'll do this. They're like, the idea sounds great. I would love to work there. I do not want any part.
I resemble that remark.
Exactly.
I'm always in Israel, but I'm trying to sell.
Exactly. So yeah, I would agree. It's a whole different hat you have to wear when running the office. And it's not what we got into this career for. Right. But it's, again, one of these necessary evils that needs to get done, because if nobody picks up the reins and takes control, then it's either you don't have good offices out there, or they're run by people who don't have compassion for the patients, which is what we're ultimately
I'm really glad you're doing it.
Exactly. I'm already now starting to get old enough. I'll start getting calls from people looking into dentistry. You've been doing this a few more years than me. Someone calls you and says, I'm looking to get in the field of dentistry. What's the advice you would give to them?
First of all, I tell them it's the greatest job in the world.
It's great.
And I can understand.
I don't know it's a beautiful answer, because I don't know that that's a universal answer by dentists.
I know.
A lot of people are burnt out early in this career.
But then again, it's not the perfect job for everybody.
Right.
For me, it's the greatest job in the world.
Right.
You got to go into it for the right reasons.
For sure.
I know that there are a lot of people now that make all the decisions based on how much am I making from this, and I heard this advice early on from I remember when I heard it. I was still a resident, and I went to one of the national meetings, one of the AOMS meetings, and as a resident, we're just looking up at all these guys that are out there doing it, and one of them, the guy from Texas, he said to this group of residents, he had this group of sycophants around him, and he said, listen, the advice I give you is just keep doing the right thing and the money will come. And you just do it for the right reason and love it.
For sure. So I tell people, be a personable human being. In every field, there are the people who better off be sitting in a lab and doing research, right? That are out there. This is a very people person field. So I feel like that's a necessary thing to be successful and to enjoy that interaction, because otherwise if you're so technical about your margins of your crown prep, that's great. Right. But if you can't relate to the human being that you're talking to,
then you become an endodontist. Sorry, my brother's an endodontist. He has a great personality, and you'll see him on this podcast one day. I have the face for radio. He should be on video. Anyhow.
But yes, to relate to people, I think is critical, to not burn out and to really enjoy the interaction with human beings. We have, as I say, 98% of the problems from 2% of the patients. That's always true. There's always going to be outliers that are difficult people to treat. All true, but I think people person for me is the biggest thing. If you have that, and you would then also enjoy the art of dentistry, you enjoy I feel like technology is such a huge part of what we do. That was my first draw when I walked into Ari Greenspan's office in Jerusalem at 18 years old, and I thought I thought dentistry in Israel were going to be a good match, and that's what I wanted to do. And he had the first CEREC in
Look how technology has exploded.
Yeah, the first CEREC in Israel in 1998. It was here in the States for years before, but that was, and I thought, wow, that's such a cool toy. And I just haven't stopped buying toys since, because it's, a huge part. So if you like technology, also huge, people, technology, science, just to be into the sciences is important. But yeah, if you have those things, and it's in good hands is also, it's a plus.
There was the Bell's Cantorial School.
Yes.
In NYU.
Yeah.
So it's named for, and I guess given the funding for initially was by Philip Baum of blessed memory, Philip Bells of blessed memory, and he, towards the end of his life, he was a cantor singer of his own right, and he wrote and took part in an opera in Memphis that I was at, and one of the lines in the song that he sang was, "In the winter of my life, I feel like it is spring again." Technology is kind of doing that now.
Sure.
I got friends that are slowing down and winding down, and I'm like, show me more.
Yeah, exactly. I would say there's great segue into the concept of technology in general. Yeah. We see, even just the way we're converting our arches into teeth, that is light years how fast this is moving. Yeah. From the standard cut holes into a denture and fill it with acrylic and push that in the mouth and cut all those back, to even the better versions of that, the smart dental conversion kits we're both using, we enjoy very much. But now we get into the concept of like external scanning, or we talk about even intraoral scanning that would be accurate enough to pick everything up. Email that over to someone to get designed, get it back in a half hour. You can design it yourself, but after surgery, I tend to be.
I wonder what's the next leap?
Exactly. I'm sure I won't sure it'll be long until an AI program can take their initial teeth, take what they're doing, and give you a 98% great hybrid restoration to print in 5 minutes. And you fine tune it later. Put it on a printer that can be done now in about 40 minutes. Yeah. And wow, teeth done. It's wild. It really is. To me, that's I think the biggest jump in our segment in surgery of technology, and I think that's where we're going. I want to hear your opinion on the robotic arms. I'm sure you've seen them.
Yeah. So
interestingly, I had one of the leading companies, I think 2 big ones. So one of the companies was here, where we talked about it. But finances aside, it's a big ticket item. But okay, anything new and great is going to always have a big ticket to it. But I asked, who are your doctors who are using it now? And overwhelmingly selling to GPs who are not yet really great implant surgeons yet. Not everybody, obviously. But they're going to use it as a marketing, because like we're doing the latest and the greatest, which is what's super cool.
So if used correctly, sure, it can prevent you from going awry. But this is not, there are certain things that robotics really help for. Prostate, for example.
Sure.
To avoid something much more radical. This is not I'm not talking about very radical. It's actually the same surgery.
Right.
It's exactly the same procedure. It's just a guide of sorts.
Correct.
99.99999% of what I do is not guided.
Correct.
Well, they say brain guided. Right? It's not. I don't use surgical guides.
So interesting. For arches, I'm having surgical guides for singles, quadrants all the time. I use that. I print them, design and print them. Big part of my practice. I used to do them for arches all the time. You would think that arches were the most important, and I used to think that. And the more I'm doing arches now, I need an idea where my teeth need to go, but then I'm fishing for where the best bone's going to be, and not necessarily is it going to be where I saw that. I thought I saw it on the CT scan. The density you go drill into it's going to feel different. I'm going to have to adjust, and if I'm only in a guide, I'm stuck. If it's not exactly where I expect it to be.
The technology that we have now to create teeth, immediate temporary printed based on the scan of where the implants are right now, kind of is taken over for what the big benefit in my eyes of the guides were. Stackable guides and that kind of thing, in that the prosthesis can be made ahead of time and relined and that kind of thing. But now I think we have an alternative. I won't call it better, even though I think it is a better way to do it.
Right.
But that was a benefit.
Absolutely.
Still would be.
Yeah, so the robotic arm, I think, will eventually have a place. And I think could be something, but yeah, to me, it just didn't seem to make sense to implement it at this time. But yeah, we'll see. I'm always just enamored. When I met the guy who started the first company, I forget which one it was, he was the same guy who developed the iCat. Wow. And I said to him, you changed the world of dentistry. I mean, by the iCat. It was really revolutionary to bring in a CT. Yeah. I remember visiting a practice out in Kentucky who had a gurney to take a CT in their private office.
Right. What was the name of that scan? I remember it.
Yeah, and how forward thinking that was to say this is a necessary part of. I can plan things on the digitally beforehand and know what I'm doing before I get into surgery. So where we have it now is I would say majority of dental practices in the States today probably have a CT machine, general practice included. Made changes. So I said, I love the forward thinking. I love that this is going to be, but yeah, same as people with the CTs early. It's like, I don't need that. I can do things great without. Until we start to see data sets that are going to show us that a robotic arm could put things in the right situations better. So I think there's a future for it, but we'll see. We'll definitely see. Let's see. In terms of, I think, a big change of what's happened since I was in school, since you were in school, where we were reading literature, which was certainly super important, still is important, but we were gaining our knowledge by papers, right? That has changed drastically.
It's YouTube now.
Right? It's YouTube.
It's terrible.
It's Facebook. It's Instagram, where we're seeing procedures now done and refined amongst other users. Group learning. Say, I have a concept. I'm going to do this. I'm going to show you how I did it. Someone's going to chime in and say, good idea. Let's do it a little differently.
Yeah.
By the time the paper's written, it's been in practice for years.
So that part I think is great. The group learning and sharing is fantastic. I'm part of several of these groups. That part's great, but the idea of I just saw that on YouTube and I'm going to go try it.
Yeah, yes, that's the flip.
That scares me.
That's the flip, and that's, I think, right. You can say that about social media in general. Someone shows their family on vacation in Peru. Great. How did that all work to get everyone there? The money that needed to be spent, the time that needed to be taken away from everything else, getting everyone there. And when you come with kids, they don't turn the cameras on. The kids are screaming. Right? We'll show you the picture. We're all here, and then someone else sees that and says, "I need to be in Peru. I can't afford it. My family doesn't want to do it." But the social media pressure. So too in the world of medicine, dentistry, surgery. That guy's doing that procedure. I'm going to do that too. Well, you don't know how long it took to get here. All the steps involved to get here. Yeah, I love that we're sharing ideas, and it really increases the thought process, the treatment planning process of everybody. But to know that, hey, you gotta walk before you can run. You gotta take steps to get here. There's the
path.
There's a path to everything, and let it expand your mind. Let social media expand what you know is possible. I think that's amazing. The first person that came in, that I had a patient came in. I need a CT scan because I'm going to India, to have a pterygoid implant placed. This is early in my career. I had to go open my anatomy book to remember where the pterygoid is. And I'm like, what the hell is someone putting an implant in that? That doesn't make any sense to me. I told the patient, you are making a giant mistake. Don't go to India, that is done. And I'm looking up and I saw in India they were using a couple of spikes that were basically hammering into there with some abutments sticking out. And I'm like, this is insane. And I judged before I thought, this is brilliant. If used properly. And I'm saying, now we're doing it. So to let social media increase your thought process and say, not to be dismissive of things necessarily, you'll see some that should be dismissed for sure. But to say, hey, there's a world out there, let me think research is better. That's great. But yeah, that social media pressure, like everyone's cases go great. No one has a failure, right? One of my favorite follows on social media is Neve Sonata. Fantastic prosthetist. Wow, fantastic, beautiful work. And he'll be the first to say when you meet him, it speaks publicly. It's like, everyone's got failures, man. Like, no one's supposed to. And we were at Orca recently, he posted his failures as reversing out. He's like, I never have failures, see? And he showed him backing out implants in reverse. They're going back in. I never have failures, it's great. So not to get beaten down by it. You have a failure, that's a path to growth. Yes, that is how you learn. I went through residency. It was a short 2-year program, and I never had a failure. And I thought, both I am God's gift, and implants never fail. Both are wrong. My wife told me. The first one. Second one is, my heart dropped the first time I had a failed implant. I thought, I obviously, and then, I don't know if you've ever experienced it, the concept of cluster failures, right? Where you just have like a week where like stuff's falling apart.
Losing my confidence.
And, right? It's just like, whoa, and you turn on Instagram, it's like no one else has my problems. And I don't want to post my problems because they're going to think that I'm the worst dentist in the world.
Well, you make some really great friends though that way.
Absolutely.
It's from social media. I have made some amazing friendships, and we're brutally honest with one another and with ourselves. Yeah. So we've continued to learn that way. So
absolutely. And I think to post your successes, everyone's posting success. You're never going to post your failures. Obviously, if you don't want to post it on a very public forum and get attacked by the trolls who don't know any different, but post it amongst like-minded dentists who can then help you critically evaluate your work. You may have done everything right and stuff's going to fail. You may have done something critically wrong and it still turned out okay. But like, hey, don't make that mistake again. I get those all the time when I run a small dentistry program. Someone will send me an implant. It's restorable, but like, do better. Like, you can do better. And I'll tell them, you did a fantastic job here. And it failed. Stuff just sometimes fails. It happens. And we'll review the histories of medical history. What can we rule out to make sure it minimizes from happening? But post your failures. Thrive on your failures. And I feel like this is said by people who...
I got a great lesson back in history on this. Pretty much almost the last year of my residency, we were all going to present, all the programs in New York, and there are a ton of oral surgery programs, we're going to present to Sir Norman Rowe. Sir Norman Rowe, he wrote the book, literally wrote the book from Guy's Hospital in London on maxillofacial injuries. That was the name of the book, 2-book set. Maxillofacial injuries, Rowan Williams or Rowan Kiley. And he was coming to New York, and we're all going to present. And every residency presented their resident. One resident got to present a case. Everybody's showing. One guy is showing they took a big toe to replace a joint. That was all kind of great. And Marty Sterner, who I mentioned before, told me, Zelig, you're going to present this case. Well, this case was a huge failure. That wasn't even mine. It was from years before.
The failure was mismanaged, not my case.
Trauma case. Mismanaged condylar fractures. It was a disaster of a case. And I said, Norman Rowe is coming here and you're making me do this. You're doing this. So I presented this case, embarrassed as can be. The entire world, as far as I'm concerned, is in front of me watching me present this disaster. And Norman Rowe puts his hand on my back and says, we learned. I congratulate you for presenting this case. We learned so much more from our failures and our successes. Suddenly I grew to 10 feet tall. It was great. But we have to be honest.
Absolutely.
As painful as it is.
And I think it has to come from a place of confidence where I I'm doing the proper training. I'm along the ride. I have great colleagues I can talk to. When you're in that world, you have the confidence to say something didn't go right. Let's talk about this so we make sure it doesn't.
Right.
I remember years ago, one of the, I forgot who presented, some prosthetist from Seattle presented a lecture about the dirty little secret of dentistry, of implant dentistry, of cementing restorations, and all that can go wrong with cementing restorations. And we just got deep into the weeds of like everything that goes wrong that we would prefer not to talk about, because at the time that was the majority of restorations. And what is going on, and we're getting bone loss, and hey, this is a mess. And he even said then, like, let's not tell our lawyer friends about this because this could get messy. I just had the other day a case that I thought should be screw retained. A referring doctor wanted to do a cement. Patient came, I bring them back for that reason to check the soft tissue, to make sure there's no ends. Lo and behold, cement under there. But if I check it soon, it's no big deal. Right. Get them numbs, feel it out. If it sits there forever. But it was all about what are the messes in our industry that are not going right. And it's okay to talk about those things because we're all doing it. And let's all better figure it out together. We can all do better. Absolutely. Wow, this was fun. I really appreciate you coming out. One question, which is an existential question, both times of career and otherwise. But I like to think about this question a lot because it's like, wow, I'm doing so much dentistry. It's tough to think that there's a whole life going on. But if you have to think to yourself, I've put my work into this career for all this time, what would I like to be remembered for? And what I do here? And I think this ties back into everything else we've been talking about because it wraps up everything and say like, why are we really doing this? What do we want to be remembered for? To make the money, no one writes on a tombstone, I made a lot of money.
Well, first I think the most important job I have is being a father.
Absolutely.
So I want to be remembered for that.
Bar none, of course.
I hope a good one.
Yes.
Other than that I really cared for people, want to do good for people, and help.
Yeah. Simple. But those are the right. You look back and like, and I think it's so important to think about this question for myself all the time, is because I can only have a meaningful day in the future if I'm thinking about what am I going towards? What's the goal? And the day to day, where the goal is just to survive the day. Like we look at the schedule, we get days.
That was a great question. Woody Allen answered it differently. Woody Allen said when he asked the same thing, he says, one guy thought, I want to be remembered as being a great, believer in God, and the next one this, and what do you want people to say about you at your funeral? And this one said, I want to be remembered as a fine Christian man. This one is a very philanthropic one, and this one, and then Woody Allen says, I want to hear people say, look, he's moving.
Exactly.
Anyway.
But yes. Okay, David, thank you so much.
I enjoyed it. Thank you.
And
pleasure working with you too.
Absolutely. Thank you so much. All right. It's great.
Thank you.
Thank you.